Hello and welcome to the N225 SPL training. At the completion of this training session today, you will be able to portray all three N225 cases proficiently, as well as the case's effect and providing feedback to the student post-encounter. Please be sure to direct your questions about the case to the assigned faculty member if you have any. Let's begin. SPs hired for this event will play one of three roles: Phoenix Heart, the cardiac case; Logan Balance, the neurological case; Chemo Remy, the respiratory case. The encounters for this event will be 20 minutes with 5 minutes of feedback with the student. SPs will use open-ended questions to provide relevant feedback to the students during the feedback phase of the event. Please remember that this is an on-site event, and the setting is a hospital emergency room. Let's take a closer look at each case. We'll start with the cardiac case, Phoenix Heart. Phoenix has come to the emergency room with chest pain after carrying groceries up a flight of stairs. The SP's opening line will be, "I am worried, did I have a heart attack?" This opening line will be given after the student has introduced themselves to generate the exchange of communication. The SP's starting position in the encounter will be sitting on the exam table. The attire for this encounter will be a hospital gown and hospital ID band for this case. Now, let's look at a sample Phoenix Heart encounter.
Come in.
Hi, good morning.
Good morning.
My name is Helen. I'm a nursing student. Is it okay if I speak with you today?
Yes. Is the doctor coming soon? I'm really worried that this chest pain again today.
The doctor will be coming in to see you for sure. I'm just here to to ask you some questions about what happened, do a quick physical exam, and then I'll be sharing that information with the provider, and then we'll come in to get it to continue the visit to make sure that you're okay.
Okay.
All right. But first, may I confirm your name and date of birth?
Phoenix Heart, August 28, 1974.
Okay. Good. Thank you so much. So I understand that you came in for some chest pain.
Yes, I had this chest pain again.
Can you tell me a little bit about what happened?
This morning I was home. I was carrying a bag of groceries, and I was going up to a flight of stairs, and then I start feeling this pain again.
Okay, so this pain has happened before.
Yes.
How long ago?
3 years.
Okay. And today when you had the chest pain, on a scale of pain scale of 0 to 10, 0 being no pain at all, and 10 being the most extreme pain you can think of, how would you rate your pain?
8.
Okay. And can you describe the pain for me?
I don't know, it's just this pain in the middle of my chest.
Okay. Does it feel heavy, sharp, throbbing?
Maybe heavy.
Heavy? Okay. And how did it go away?
I don't know, maybe resting.
Okay. And are you having any pain right now?
Not right now.
And have you had any reoccurrence of the pain since this morning?
No.
Okay. And are you having no pain right now, you said?
Not right now.
Okay. And what happened when you had the pain 3 years ago?
I remember I was still doing something heavy. Don't really remember what I was doing, but I remember I had this pain 3 years ago. And I went to the hospital. Yeah.
What happened with that?
In the hospital?
Yes.
I had a cardiac cath.
Okay, so you had the cardiac cath.
Mm-hmm.
And how are you following up after the cardiac cath?
The doctor just told me to follow the medications prescribed.
Okay, so you are seeing a doctor, you're taking medications. And what medications are you taking right now?
I'm taking Lipitor and Labetalol.
And what are the dosages of your medications?
Lipitor is 20 milligrams and Labetalol is 100 milligrams.
And how often do you take your medications?
Lipitor once a day, Labetalol twice a day.
And when was the last time you took your medications?
This morning.
Okay. And for what conditions are you taking the medications for?
For high blood pressure and high cholesterol.
Okay. Do you have any allergies?
No.
Okay. And it sounds like, so that's a cardiac event. Is there any family history of heart disease?
Actually, yes, my father.
Okay. And how's your father now?
He passed.
Oh, I'm sorry to hear that.
Thank you.
And how old was he when he passed?
35.
And sorry about that.
Thank you.
How's your mom?
She's good.
Okay, good to hear. And do you have any other family history of illnesses?
I don't think so.
Okay. Besides the cardiac cath, have you had any additional procedures or surgeries?
No.
Okay. And from a social perspective, what is your work? What do you do for work?
I'm a landscaper.
Okay. And what kind of landscaping do you do?
Mostly houses.
Mostly houses? Do you have to do any heavy lifting during the work?
Sometimes.
And do you ever experience that kind of pain, the
No.
chest pain?
Not really.
Okay, good to know. Do you currently smoke?
I do.
Okay. How much do you smoke?
A pack a day.
How long have you been smoking?
About 25 years by now.
Okay. Have you tried to quit before?
No.
Are you interested in quitting?
I really would like, but it's very heavy.
It is really difficult to quit. We understand. Well, let's address what's happening right now, and then if you're interested, we can definitely talk a little bit about strategies for you to help you stop smoking. Do you drink any alcohol?
Occasionally.
How frequently is occasionally?
Once a month.
Once a month? Okay, and how much do you drink?
A glass of wine.
Okay, sounds good. And any use of recreational drugs?
No.
Okay, good to know. I'm just double checking to make sure that I have all the information I need. Do you have any siblings?
I don't.
No siblings, all right. Is there anything else, any questions I can answer for you at this time?
Am I having a heart attack?
It is really hard to say. We need to get additional tests. But right now your vitals are stable. Your blood pressure is a little bit high, but that's understandable. But we'll get additional tests. The provider already ordered a EKG, so we'll get that done as soon as possible. But first, I do want to take a quick listen to your heart. Is that okay?
Okay.
To your neck arteries. Thank you so much. Is there anything else I can do for you before I leave the room? Okay. So we'll be right back. I'm going to speak with the provider. We'll come in a few minutes, okay? You stay put and just give us a call if you need anything.
Okay, thank you.
Thank you.
Key points of the Phoenix Heart Case. Be prepared for the students to listen to your heart. They may ask you to lower your gown to allow greater access to listen to your heart and neck. Dress accordingly per the SP handbook. Review written case details sent to you prior to the training and event date. Logan is in the emergency department after falling at home and hitting their head. The patient is still dizzy and has a mild headache. The doctor has ordered the nurse to do a neurological assessment. When the students get the patient up to walk and check gait, the patient is to lose their balance or seem dizzy. The SP's opening line will be, "I've been feeling dizzy and hit the side of my head." This opening line will be given after the student has introduced themselves to trigger the exchange of communication. The SP's starting position in the encounter will be sitting in a chair. The attire for this encounter will be a hospital gown and hospital ID band for this case. Now, let's look at a sample Logan balance encounter.
Come in.
Good morning. Hi, my name is Helen. I'm a nursing student. Is it okay if I work with you today?
Sure.
Hi. First, may I check your name and date of birth?
Logan Balance, 1/1/1959.
Okay. Thank you so much. So I understand that you came in with some dizziness and a headache.
Oh yeah, I feel so dizzy. I fell a few hours ago. I hit the side of my head.
Okay, sorry to hear that. Which side of your head?
This one.
Okay. And are you currently having any pain?
Yeah, a little bit. I'd say it's mild. It's
On a scale of 0 to 10, with 0 being no pain at all and 10 being the most extreme pain that you can imagine, where would you place your pain?
It's about a 4.
About a 4?
I'm sorry, I just feel so dizzy.
Oh, I can totally understand. Don't feel like you have to look at me if that makes it worse. I'm totally okay with that.
Okay.
Can you describe the pain for me?
Sure. It's just kind of in the one spot where I hit my head.
Is it a sharp pain? Is it throbbing?
I'd say it's throbbing right now, but it's mild. It's not very severe.
Has the quality of the pain changed?
No.
It's been the same.
Yes.
How about the intensity of the pain?
No, that's remained about the same as well.
Has anything make it better or worse?
Well, I just feel a little unsteady, a little dizzy.
Okay. And do you feel any nausea or vomiting?
No, not right now.
Any changes in your vision?
No.
Okay, good. You feel dizzy, you hit your head. What were you doing when you got dizzy?
Oh, I was just trying to get out of the house in a hurry and I just stumbled over a rug.
Okay. And has this happened before?
No.
Okay, I'm sorry this happened this morning.
Thank you.
All right. Well, I do have some just kind of general history questions I need to
Sure.
ask you.
Of course.
Just so we have it on record, and I can share this with our provider, and then that would give them more information as well. So how old are you now? You are born in
65.
65.
Yes.
Oh, and are you married?
Yes.
Okay. And are you currently working?
No, I'm retired.
Very excellent.
Okay.
Do you have any history, a medical history?
I get migraines.
Okay.
I've gotten them for my whole life, and I have hypertension.
Okay. And so given that you have a history of migraines,
Mm-hmm.
this pain that you're experiencing now is different than the migraine pain.
Yes, it's
Okay.
different.
And you say you have hypertension. Are you taking any medications for either of these conditions?
I do take Motrin for the migraine, but
Okay.
only when I need it, and I take a blood pressure medication, but be darned, I can't remember the name of it right now.
Okay, no problem. We can try to get that later.
Okay.
But I will mark it down, so we'll make sure to remember to follow up. Okay. We can take a moment if you need to.
You can go ahead.
Okay. Have you have any history of being hospitalized?
No.
Have you
No,
never
for
had?
childbirth, that's all.
Okay, good. How many children do you have?
Just one.
Okay, great. And how old is your child?
She's 39.
Okay. And what's her name?
Cecilia.
Oh, beautiful. Okay. Does she live in town?
Yes, she does.
Okay, great. And have you had surgery for any reasons?
No.
Okay. And you don't work. Do you drink alcoholic beverages?
No.
Do you smoke?
No.
Any recreational drug use?
No.
Okay. So you take the medication for your blood pressure and the Motrin for migraine. Oh, when you take the Motrin, what's the dosage that you take?
Usually 400 milligram.
Okay, and that helps with the pain.
Yeah, that's 2 pills.
Okay, good, thank you. And do you take any over-the-counter medications besides Motrin?
No.
Any supplements?
No.
Okay. Any family history of illnesses?
No. Both my parents are deceased, but
Okay.
everybody's been healthy.
Okay. And do you have any siblings?
Just one, and she's healthy.
Okay, great. All right. And from just, a normal daily lifestyle activity perspective, how would you describe your diet?
Pretty normal, pretty healthy. I try to eat well.
Okay. And physical activities?
I walk every day.
For how long do you walk usually?
Probably about a half an hour, 45 minutes.
Excellent. Great. Any allergies to medications?
Penicillin.
Penicillin.
Yes.
What's your reaction to penicillin? Do you remember?
Yes, I do get a rash.
Okay. Any other types of allergies?
No.
Okay. Anything else you think I should know that I did not check on?
No, just I have to let you know I'm feeling dizzy again, so.
Oh, no, that's absolutely understandable.
Okay.
I am gonna have to do a quick physical exam, and then I will let you be, and the provider will be in to see you, okay?
Okay.
Okay, is there any tenderness when I touch
A
here?
little bit, yes.
Sorry about that. Just gonna feel back here. Okay. Through your neck. Any tenderness when I feel?
No.
Okay, good. For this part of the exam, I may have to ask you to take off your glasses.
Sure.
Is that okay?
Yeah.
Thank you. Okay, first, I'm going to have you look straight at me.
Mm-hmm.
Don't move your head, but I'm going to ask you to use your eyes to follow my finger, okay?
Okay.
Don't move your head, just your eyes. Excellent. Follow. Okay, good. And open your mouth wide. Stick your tongue out for me. Perfect. Thank you. I'm gonna have you push your face against my palm. Great. This side. Okay. Try to shrug up. Great. Awesome. Can you hold out your arms for me, please? Don't let me pull. Don't let me push.
Mm-hmm.
Great. And I'm gonna shake hands. Okay, I'm gonna squeeze really, really hard on both sides.
Okay.
Just really, as hard as you can, you won't hurt me.
Okay.
Harder. Great. Thank you very much. Anything else I can do for you before I leave?
Not that I can think of.
Okay. Oh, I'm sorry, I do have to check your gait, I just realized.
Oh.
Do you feel comfortable standing up?
Sure.
Okay, so let's try. Oh, okay. Okay, let's sit back down, please. Okay. So, thank you for trying. Is everything okay?
Okay.
This helps a lot, okay?
Thank you.
And take care of your glasses.
Great.
All right. Oh, one more thing. I just realized I forgot to check your pupillary reactions. You gotta look straight at me. So. All right. Thank you so much for your time.
Sure.
I'll be right back with the provider, okay?
Okay.
Key points of the Logan balance case. Be prepared for the students to perform a neuro test. Examples of neurological tests are looking in your eyes with a pen light, having you follow their finger with your eyes, strength tests, etc. SPs should appear to lose your balance and/or get dizzy when standing up. Do not fall to the ground. Allow the students to corral you and place you back in the chair. Review written case details sent to you prior to the training and event date. Chemo Remy is in the emergency room with shortness of breath, a productive cough with rust-colored sputum. They have recently returned from a trip to Guatemala. The SP's opening line will be, "I have been sick ever since I got back." This opening line will be given after the student has introduced themselves to prompt an exchange of communication. The SP's starting position in the encounter will be sitting on the exam table, while having difficulty breathing. The attire for this encounter will be a hospital gown with a hospital ID band. The case has a prop, a tissue with rust-colored sputum. This prop will be provided by the CICSP staff.
Come in.
Good morning.
Good morning.
My name is Helen. I'm a nursing student. Is it okay if I work with you today?
Yes.
Okay. First, may I check your name and date of birth?
Ken Remy, August 28, 1984.
Okay, thank you so much. So I understand you're here because you're having some difficulty breathing.
Yes.
Okay.
I have been sick since I returned from my trip.
Okay, where did you go?
Guatemala,
Okay, and how long were you there for?
3 weeks.
3 weeks? Okay. And how long have you been sick?
Well, I returned 5 days ago, so it's 5 days by now.
Okay, can you tell me what are some of your symptoms?
I can't breathe and I'm coughing.
Okay. Any other symptoms besides coughing and short of breath? Have you had a fever?
No.
Okay, any chills or rigors?
No chills, no.
Okay. All right. And what were you doing in Guatemala?
I'm a volunteer with Peace Corps.
Oh, okay. Great. Thank you for doing that. So you were there for 15 days. Okay. Just taking some notes, I don't forget. I'm gonna ask you some additional, a few more questions, and then I will do a quick physical exam. Then I will share my information, the information I gather with the provider. Then they'll come in to assess you. Okay.
Okay.
How old are you?
40.
Okay. Are you married?
I am.
Do you have any children?
No, I don't.
Okay. And I know you volunteer with the Peace Corps. Do you work outside of that?
No.
Okay. Do you have any diagnosed medical history?
I have asthma.
Asthma? And do you take anything for that?
I do.
What do you take?
Albuterol.
Albuterol? And how often do you use it?
Every day, multiple times per day.
Multiple times a day?
Yeah.
Okay. And do you see someone for the asthma?
I'm a doctor.
Okay, good. And do you have you had a history of having any kind of procedures or surgeries?
No.
Okay. From a social history perspective, do you currently smoke?
Oh, no, I don't.
Have you ever smoked?
No.
Do you drink any alcoholic beverages?
No.
Okay. Any recreational drug use?
No.
Have you been hospitalized for any reasons?
No.
Okay. Any family history of illnesses?
No, I don't think so.
Okay. Your parents, are they both living?
Yes.
Okay. Great. Do you have any siblings?
I don't.
Okay. Let me double check this. From a lifestyle perspective, how would you describe your diet?
I try to eat healthy, and be, yeah.
Okay. And do you do any physical exercise?
I ran a marathon recently.
Okay, so you're a runner. Okay. Did you do this before you left for Guatemala? Okay, great. All right. Besides the albuterol, do you take any other medications?
Claritin.
Claritin?
Mm-hmm.
And what do you take that for?
The allergies.
Allergies, and what are you allergic to?
Ragweed and pollen.
Okay, great. All right. Okay, I think I covered the essentials what I need right now. I know I can see that you're not feeling well.
Yes.
With the cough, are you coughing up anything?
Yes, I cough this and that. Is this
Okay.
a symptom of possible, how is it called, the tuberculosis or what?
It's hard to say. We need to do more tests before we can determine what's happening. The key things are you're here, and that we will be able to help you, okay? But I just need to take a quick listen to your lungs, and then we'll get the provider will come in to assess you too.
Okay.
Okay, I just have you set up for me as nicely as possible. Take a deep breath in and out for me. Again. Okay. Okay, looks like you're having more trouble breathing. I'm actually going to go out and get the provider, all right?
Okay.
Okay. Are you okay? I'll be right back.
Okay.
Key points of the chemo-REMI case. Be prepared for the students to listen to your lungs. Dress accordingly per the SP handbook. Appear to be short of breath. Be sure not to hyperventilate. This will prompt the student to call for a provider before the case leads the student to this conclusion. Be sure you have your case prop, the sputum tissue. Review written case details sent to you prior to the training and event date. At the end of the encounter, the students will leave the exam room, then return for feedback. Take this time to de-roll from the encounter. Please keep in mind that due to time constraints, the students may not leave the exam room. In these cases, an SP can ask the students for 5 to 10 seconds to de-roll before providing feedback, if necessary. Remember the basic assumption when providing feedback to the students. We believe that everyone participating in activities is intelligent, capable, cares about doing their best, and wants to improve. When providing feedback to students, your questions will be open-ended and relevant to the past encounter. Here are some examples of questions for the students. What was it like for you in this past encounter? How did that encounter go for you? How did it feel caring for patient's name in this situation? What were your first impressions of how that went? Here's a review of key points of the N225 cases. Review the written case material that is sent prior to this training. The training materials are sent at least 24 hours prior to the training. Once the materials are sent, it is the SP's responsibility to prepare for both the training session and event. Your attire for the event will be a gown. The students will need to access vital areas of the SP to complete their objectives. The feedback SPs provide to students will be open-ended, relevant to the case and with the goal of helping the student to improve. If you have questions about the cases, the event, or are having an issue, please do not hesitate to reach out to the CICSP staff via email at cicsp.cnhp@drexel.edu or call us at 215-783-0277. You can also reach out to the N225 faculty with questions about the case. Thank you for watching.